everyone. Good morning, good afternoon, and good evening to all the people joining in from different parts of the world. Welcome to PMAC 2021. So my name is YY Teo. I'm the Dean for the Saw Swee Hock School of Public Health at the National University of Singapore. It's a real privilege for me to be moderating today's session and to welcome on behalf of the PMAC Secretariat and my fellow panelists, all of you who are attending today's session from wherever you are. Today's session, it's co-hosted by the National University of Singapore, the Thai Health Promotion Foundation, and USAID. And this particular session really is going to discuss how we start to build, to develop, and to prepare systems in different countries to cope with future trends. I think it's quite clear that all of us listening in will understand how COVID-19 have changed the world, changed the way that we have operated, how we lived our lives. But I think if we look back not too far ago, back in just November 2019, where there was a release of an assessment of pandemic preparedness, which is namely the Global Health Security Index, I think the indicators highlighted to us how well prepared some countries are and how poorly prepared other countries are. But in terms of preparations, I think that's where the reality that we are facing in the world right now shows us something extremely different. And if you haven't had the chance to look up the Global Health Security Index, feel free to look it up on the web and compare it with what we see right now in terms of the performance and the outcomes that the world is facing as a result of COVID-19. And I think that this gives us a very important reality check in the way that the world can come together to address major crises such as COVID-19, or in fact, in future, an unknown disease X, or perhaps even other global trends such as climate change, the rampant expansion of antimicrobial resistance, or other global health challenges that may be linked to population expansion. And as we start to look at the lessons that we have learned from COVID-19, it is just as important to start to think about what kind of preparations that we need to put in place to cope with future global crises that will have the impact, the ability to impact the lives of millions or even billions in the world. So today's session will really look into some of the building blocks of a systems level response into forecasting as well as into actually tackling some of the challenges that may emerge as a result of some of these shifts in global trends. And before I introduce tonight's panelists, I wanted to mention that the proposed format for this session is that of a Davos format, where after I give this introduction, I will actually invite each speaker to lay out his or her talking points within a span of 5 to 6 minutes. We will not take any questions after each speaker, but as all the speakers have presented their talking points, that is when we will have a moderated question and answer session. The duration for today's session, after excluding the first 5-6 minutes of introduction, will be around 85 minutes. And before we commence the session, I would like to remind any of you who would like to pose questions to the speakers, to the panelists, to please use the Q&A function on Zoom and type your question. We will moderate, we will curate the questions that appears, and we will ask the respective panelists or the entire panel your questions. And a final mention, which is tonight's session will be recorded just as all other PMAC sessions, and please visit pmac2021.com to view the rerun of today's session or any other session that has been recorded. Now, without further ado, I would like to introduce my panelists, and it is a real privilege that we have members and speakers from different parts of the world joining us today with different expertise and experiences. So we have Dr. Mary Nang Mongo, who is the Executive Director and Founder of the African Institute for Health and Development. We have Dr. Fernanda Zamoglio, who is a thought leader that oversees climate resilience and adaptation policies at the US Agency for International Development. We have Dr. Suprida Aduyanon, who is the Chief Executive Officer for Thai Health Promotion Foundation. We have Mr. Dermot Campbell-Langdrum, who is the head of the World Health Organization Department of Environment, Climate Change, and Health. And finally, we have Dr. Dale Fisher, who is the chairman of the steering committee for the WHO Global Outbreak Alert and Response Network. So first off, I would like to pass the screen over to Dr. Mary to give her talking points to the audience. Over to you, Dr. Mary, please.
Good afternoon, good morning, good evening, participants. It's my pleasure to take you through a few points. When I was invited to this session, I wasn't very sure how to pitch my discussion, but I'll look at two areas of work around health systems and social protection systems in Kenya, where I've worked for a while and where we can draw a lot of lessons for building better in future. When COVID started ravaging some parts of the world before it became a problem in Africa, we basically felt it was a disease out there. It was affecting people elsewhere, but in Africa, we felt we behaved and approached it as if we wouldn't have a big challenge the way other countries were struggling with managing COVID. I think the issues in Spain and in Italy really made us think this is a terrible disease, but we're a bit removed from it. It's only on 13th of December when the first case was announced the 13th of March is when the first case was announced in Kenya. And we panicked. The government panicked, Kenyans panicked. We basically looked around what was happening globally, and our actions really were mirroring what was happening elsewhere rather than taking our own country into context. Again, the need to think strategically when approaching a pandemic. And I think one of the key lessons we've learned is to plan locally and plan within the context of where we are. Currently, we are approaching 80,000 cases, and the deaths are around 1,400, which in the African region, Kenya is ranked 7th, with South Africa leading the way. However, because of systems, we suspect there's a lot of underreporting of the cases, underreporting of hospitalization and deaths due to systemic issues that I may go into later on. And therefore, we've been very reactionary. If you look at some of our measures, such as curfews, partial lockdowns, and stay-at-home orders, were very reactionary, and some of those challenges are because of systemic challenges. So essentially what I've said earlier, travelers are the ones who brought it in. So there was a lot of reluctance to address the issue as an issue that would eventually affect the entire country. And then when we started panicking, our actions then included police enforcement. And for those who follow media, we had a few cases of police brutality, lack of tangible support to families, although one of the social measures was stay indoors, but there was really no tangible support to households to ensure that they stay at home but still get their basic needs fulfilled. And also the emergence of COVID came in also in a time where there's a lot of distrust in our government, and we saw a lot of that happening, playing out in terms of quarantine issues, who is supposed to pay, is it government issue? So essentially there was the month of March and the month of April, we saw a lot of lack of preparedness, a lack of a strategic approach. to addressing COVID-19 in our country. And therefore, we ended up having leading to stigma and other social challenges that have continued to affect the approach of the government to addressing COVID-19. Measures put in place to contain the spread also have had an adverse effect on the poor, more so those who are engaged in formal economy. Some in March, a lot of the industries, small industries that account for around 84% of labor force in this country were closed or were operating at a very low level. So we had a lot of our households, especially those who are poor or at the margin of poverty, leading very difficult lives. We also had another effect was limited use of health facilities, even for routine services. I also work in the space of non-communicable diseases. We had our people on routine treatment for diabetes, for hypertension, for cancer, failing to go for healthcare because of the challenges around movement and the focus towards COVID. And as we know that NCDs is a key underlying condition for severity of COVID-19 outcomes. Again, loss of income has pushed many households to poverty, especially those that were tinkering at the margin of poverty. Again, in Kenya, 39% of our population live below the poverty line, of course, with a lot of regional variations. That's why I talked about stigma setting in. We didn't know what this was. We didn't know how to contain it. And therefore, because initially it was a Nairobi issue, so the rural areas, they started stigmatizing people in Nairobi. And there was a lot of uncertainty in terms of the projection and the disease prognosis as we went along. And what are some of the lessons learned? Limited investment in prevention with a lot more focus on curative, such that when the corona became a reality, we focused on testing, tracing, and treating those who who are infected. We forgot to prevent. And because historically in our country, only 5 to 10% of the national health budget is allocated to prevention and promotion. That's why I admire Thailand a lot, because of their focus on prevention. So you can actually see that playing out now. Since October to November, our numbers have really risen because of the community infections that are currently going on. So in terms of historically, we haven't focused on health promotion or prevention. And this has come to bite us, that we still were focusing on curative instead of focusing on behavior change and molding behavior, especially before we got into community infections. Lack of a robust social protection system that even though we told people to stay at home, even though we told companies closed, we really do not have a system of social protection that can expand and contract at will, depending on need. And so that played out a lot, although my presentation has examples of the government coming in, providing water for people in informal settlements, doing a cash transfer. Again, the period, the decision on who to support was not based on a robust system. And so there have been problems with that. Inadequate civil registration. Again, we are not sure whether the deaths are all being recorded, whether we have the right data. I know this is not a problem only for Kenya or for Africa, but it would be important for us to have a system that then tracks what's happening at the community level. Lack of transparency and accountability. And this continues to be a problem. I'd be failing my country if I didn't talk about this. There have been a lot of rumors, there have been a lot of stories around how we are accounting for COVID funds, and some of them are given by development partners. And so that in itself is a system issue that I think as a panel and as participants in this meeting, we may want to talk about. There are several measures taken by the government, but I only have 5 minutes, so I may not go through them. Some included giving masks to the poor and vulnerable, especially those in informal settlements in urban areas. We also had a cash transfer that was meant to help people, to cushion people who had lost their jobs. That was also short term. Again, that's another problem that we are encountering in this era. We also had a lot of support going to medium-term NGOs, small enterprises, to support them deal with the economic losses. So there are many, many different measures that were put in place. The key challenge is they were not inbuilt in an existing system. Some of them were ad hoc, and some of the targeting was questionable. So we have a system, a country where this is a big problem. We have put measures in place, but we are unable to ensure that it goes within an existing system, but also that the health system and the social protection system are weak in themselves before even COVID-19 became a problem. So what are some of the key challenges we've seen? Health system, to date, again, we have a system where PPEs have been a problem, personal protective equipment, access to even health workers have been problematic. We also have had a number of health workers, like in other countries in the world, being affected and succumbing to the virus. The cost of treatment has been out of reach for many people. At some point, people are supposed to pay for the test, and if they're hospitalized, then they need to pay. A lot of insurance companies then come up and say, we cannot pay for COVID infection. So I think the health systemic weaknesses have come to play out. I would want to hear what is happening in other countries. I've talked about the issue of social protection and the weaknesses around the surveillance systems. There's been also inadequate attention to behavior change. The initial efforts were really medical oriented rather than community oriented. And that, as I said, is a bias we've seen ever since, where a lot of our resources go into curative care. And also our leadership has not helped. This is our political leaders holding massive meetings with a lot of people when we are talking about staying at home, social distancing. So if people see this, if Kenyans see this, it's very difficult for them not to emulate or not to overlook some of the health ministry's guidance. So do what I say, but not what I do is something we've seen, and that has also come to bite us. The other challenge has been lack of trust, and I alluded to this earlier on. Initially, the numbers were supposed to be very high. The modeling showed us the numbers would be very high. The numbers have not been that high, and therefore a lot of questioning around what was the basis of this. Inadequate coordination of partner support. Again, a lot of our development partners work directly with communities, and we've seen the government trying a lot more to bring partners together. But this should have started before the pandemic. And that's another lesson we are learning, how to bring partnerships supporting the government of Kenya together in this. There's also the challenge of lack of sustainability of the measures put in place. A lot of the money has been borrowed from development agencies. We have borrowed money from World Bank, IMF. And so the question I would ask as a person is, how sustainable are this in the systems in this country? And therefore, that's a question that I think we can also think about. What are the opportunities to build better? We need to adopt the lessons learned in the health sector, need for homegrown solutions to issues including pandemic, not to be reactionary, not to wait for the pandemic to come and then we act. We need to act earlier. We need to use established systems to reach out to the vulnerable and marginalized. We need also to build on the universal health coverage and the National Health Insurance Fund. When insurance companies say we cannot fund, we cannot pay for COVID, what do poor people and the vulnerable fall back on? So universal health coverage is very important currently, and to fund our own national systems. Secondly, build on the intervention structures put in place at this moment in time. Responses should build on and strengthen existing systems, including social protection and the health systems that have been put in place to address COVID-19. We need to build on that, strengthen those, improve on them to prepare better for future pandemics. Enhance partner coordination in the country to ensure the resources are planned for and used equitably across the country. Again, we do need to have partner harmonization. We've had partners doing different things, duplicating effort, not targeting specific communities that are vulnerable. So we can build on that, ensure that we enhance this partnership. We also need to identify and address specific gaps, documentation of persons, including the disease. This is a systemic problem. We do need to improve on that. We need also to have resources allocated for health promotion and prevention activities. We could do better. We could learn from other countries. I mentioned Thailand before. We could learn from other countries so that we build those systems at the community level that would help us meet the needs of communities when there's a problem, when there's a pandemic, or routinely as we continue to deal with health problems. Again, we need to actually invest in disease surveillance. Given my time, I think I've run out of time, but if we come together, we can actually kick COVID out of Kenya. Over to you. Thank you very much.
Thank you very much, Dr. Mary. And it was a very important reminder on the importance of primary care, especially primary care services in the community to look after the population during a time of crisis. It could be COVID-19, or it could be equally be other crises that we will face in the future. So next on, we have Dr. Dale Fisher, who is the chairman of Steering Committee for the WHO Global Outbreak Alert and Response Network. Dale, over to you to lay out your 5 minutes talking points, please.
Thanks, Wai. It's a privilege to be here. Thanks for asking me. My brief was to talk about trust and social capital between governments, public policies, and how to make system level consideration that integrates information and insights from all the leaders of academia and civil societies, government and industry. So at first, when you asked me to describe that, I thought, I don't even understand the question, let alone come up with the answer. So, but it was thought-provoking, and I started to think about how this will play out. Interaction reviews are starting to happen. Some countries have already done them. This is to look at how the COVID response has been going so far. That can be done at a national or a sub-national level, even an institutional level. Because while the vaccine news is so far very pleasing, it means nothing until we know if the effect is sustained, and in fact that the vast majority of the world is actually vaccinated. So it's actually a concern of many of us that people will take this news as, phew, we made it, it's over, when of course it's not until we've got most of 7.8 billion people vaccinated, and it sounds like jabbed twice, and we can think about whether boosters are going to be needed. So there's a lot of work to do, and this is going to take easily another year or more. So it won't be good enough to await for post-action reviews, because even if everything goes smoothly, we've still got a way to go. So clusters and community spread are going to continue, and hospitals will always be at the risk of being overwhelmed. Excess deaths will occur unless you can implement the non-pharmaceutical interventions successfully. So everywhere needs to keep trying to find that sweet spot between health and the social and economic impacts of the pandemic, and it's got to be a continuous learning process. So that brings me kind of to, how do you find that sweet spot, and how and who do you learn from? And I think probably the most clear thing, if you look at the global epidemiology, is that East Asia has clearly outperformed Western democracies, and it's probably done, certainly in health terms, with numbers and deaths really quite the opposite in the two areas. So it's obviously not the logistics or the epidemiologic or laboratory or the IPC or the case management capacities. We know the other countries are wealthy enough and smart enough, and they've got the ability. The component that is missing, if you can put it down to one thing, is actually so often left out of outbreak responses, and that's risk communication and community engagement. So leadership, coordination, academia and science, they all need to function in sync. And I think that is happening in East Asia, and there's no threats. It's working together for that sweet spot. Whereas I think in countries where the health outcomes aren't nearly what they should be, then this is where the disconnect has come. So I think often, or too often, there's been a perceived competition between health and the economy. But of course, many people are now saying the best thing for the economy is to control the health. So this, again, I keep saying sweet spot, but I think that's the target. So everything, all these efforts need to gel at a leadership level, but it's, as I say, with science and industry leaders and community leaders and things like this. But most importantly, it all needs to gel with the community. And if the community doesn't understand or is confused, it doesn't matter whether it's an Ebola outbreak or a COVID-19 outbreak, the community will rebel, or at least enough of the community to cause a problem. So what Western democracies do now would actually not have been considered feasible back in February or March, when we were talking about ramping up during their lockdowns, and they need to ramp up the contact tracing, they need to isolate their positive patients, they need to ensure that quarantine of contacts is in place. And later, by about late March, April, when we were advocating universal mask wearing, Western democracies were still fighting that, saying we can't bring it into our communities, it's unacceptable. Whereas in fact now, I'm told reliably by many friends overseas, for instance, in the US, 80 or 90% of people are complying with all these types of messages. They are wearing masks, they are socially distancing. So it showed that it was possible, and that's what I hope going into the future. People don't take things off the table on the basis that it's not possible. It's challenging, but I think that engagement with community and respecting that if messages are sent clearly and explained, then it's not an impingement on their individual rights. It's more a building on their community obligations, and this is a phrase that's being thrown around a little bit more, which I think has better uptake in East Asia. How you bring in things, whether it's through buy-in or national decrees, that's for each country to decide. Some would call it cultural. Some might say it's some indoctrination at a school level, but whatever, there are right things that need to be done, and unfortunately it's taken a disaster to make those right things clear. So the short answer to the question is it's all about communications, I think, to deliver a better world into the future. I think as the pandemic continues and in the aftermath, communities need to increasingly understand this harm that comes from a lack of cohesion and a refusal to sacrifice those perceived rights. It's interesting, they say, I don't want to do that because I'm free, yet then they're under lockdown. So it's always a trade-off. The tone of leaders and influencers is key, and harmony between those people. So where are we going in the future? I must say I could be pessimistic. Often after, in the wake of an outbreak, there's a lot of enthusiasm that things will be better. Infection control in the country will be ramped up. Engagement will be better. People will understand their community obligations. But too often, these become, I guess, dinner time stories where you just reflect on what happened in 2020. Oh, it was really crazy. We had to do this. And unfortunately, everyone's gone back to the way it was before. So I think we've got an opportunity during and in the wake of this pandemic to see improvements in society across the board and greater equity. But time will tell. Why?
Thanks very much, Dale. I think it's a very important reminder in terms of working together as a system, not just the government sector that's responsible, but even academia, the community, the civil societies, the NGOs, the industry, to really look at how to tailor the necessary response such that things actually do work to protect people. And I think it's very nice that both yourself and Dr. Mary highlighted the importance of health promotion and the participation of the community, because the next speaker, Dr. Suprita, the CEO of Thai Health Promotion Foundation, will highlight some of the important lessons from Thailand on why the response in Thailand has been successful in keeping COVID-19 at bay. So Dr. Suprita, over to you for your presentation.
Good evening from Bangkok. It's my pleasure to present you what happened in Thailand and what are the key factors to control the pandemics and how we can prepare to the next global health security threat. So Thailand is one of the most favorite flight from Wuhan, China. Therefore, we firstly detect the first case outside China in 13th of January, quite early. But this because we start to do the airport screening 3 days after the announcement of the pneumonia abnormal cases in China. During January to early March, the case slowly increased until the super spreader cases from boxing stadium and nightclub that made Thailand reach 100 cases in 15th of March. And after 1,000 cases reported in 16th of March, we declare a nationwide state of emergency. And Bangkok lockdown plus suspend Thai New Year's Songkran festival. In April, the cases were going down until 4th of May was the first time that no new infection. We have started easing the lockdown that has been implemented for the whole month of April from time to time, and now we reopen everything. Everything is back to normal, but with fully aware to the second phase of the COVID-19, which would be occur in the near future. So what is our key factor to control over the pandemic in Thailand? From many studies and many reviews from many evaluation teams, including World Health Organization, we may point out 3 main points. First, the whole society response. We imply multi-sectoral collaboration and key stakeholders to help control the situation. This includes government sector, industry, religions, and all walk of life of people. All respond to the situation and follow the new normal guide by the Center of the COVID-19 Situation Administration. This also includes the cultural aspect as well. The resilience and empathy of Thai society have functioned as We, from the people, individually to community and society, adapt to the situation and the crisis at their level. Second, the so-called primary healthcare system. We, for the 4 decades of investing in primary healthcare system, more than 1,000 public hospital and 10,000 primary health promoting hospital. We all construct all over the country with the 1 million village health volunteers, the unsung heroes, provide a door-to-door visit to over 75,000 villages near and far. They are mainly women who know their community very well. They give us the capacity to do the early detection and control the pandemic within each cluster of village. Third, disease control system. We took early action. We quite have the effective and well-prepared disease control system. Experiences from many new emerging disease before, like MERS, SARS, or bird flu. We took early action, as mentioned, and we have the airport screening in a very early stage. And we established the Center for the COVID-19 Situation Administration, chaired by the Prime Minister, to monitor the case and provide a regulation and guideline for the public. We have the nationwide public cooperation effective measure. We also concerned about the health crisis communication. So we create a single channel to communicate with people that involve multi-sectors. So let's take a look deeper into what we have built for the strong health resilience. We have 2 systems functioning side by side. Firstly, in the healthcare system or health service system, we have that disease control function, and second system that run together is may so-called the contemporary concept of health promotion, which involve with the wider health system to link people together. Normally, it mainly responsible for the non-communicable disease to stop the NCDs with the behavioral and lifestyle risk factor. It adapts for in this time to communicable disease. With the universal coverage scheme that adopted for 20 years ago, it provides universal service to everybody in the country. So the equity in the basic service to cope with COVID is quite very well. So these 2 systems come together for the disease control and the primary care service with the universal health coverage, together with the health promotion for behavioral change and societal change together. So with those experience from the mega crisis of COVID-19 pandemics, we would like to propose to synthesize this lesson learned about what we need to prepare for the next global health security threat into 3 main factors. Firstly, as I mentioned, contemporary health promotion concept. This will create multi-sectoral approach to work with the lifestyle and cultural aspect, and bring people and bring the strengthening community together with the strengthening the healthcare system, as I mentioned, particularly in grassroots primary care to raise with the USG to let the health equity in people. And thirdly, we talk about to adopt the new norms of the both people and society that I will expand in the next slides. This slide, this table will show you the new normal in the level of personal level, societal or environmental level, as well as at the system level, in two main things. In the hygiene part, that may prevent the new disease, the new virus. However, there is another aspect of the immunity to prevent any kind of the threat, the future threat from the new emerging disease or crisis. At the hygiene level, at the hygiene aspect, at the personal level, anything we do now, either body cleanliness, wearing masks, hand washing, contamination reduction of food safety should go on, even if not as heavily implement as COVID-19 time. It may be should be improving and to maintain our personal hygiene. In the societal level, social distancing should be aware. When we talk about the check hand for say hello, it should be actually the why in Thai style or Indian style. The improving of the sanitation and to use the telecommunication to keep distance and avoid the crowded of people. At the system level, healthcare service may be changed. In Thailand right now, the appointment for the patient in the hospital was revised to make the overcrowded OPD, for example, either work from homes in the workplace, even this better situation. Many companies, many workplaces still keep it at some certain level. That also make the work-life balance, not only to prevent disease, or the transportation, the online education, increasing proportion online to offline education in Thai school now, and also food retail delivery and so many things. However, not only the prevention disease, in terms of immunity, for us to ready to cope with any threat in the future, at the personal level, health promotion to improve the healthy body, healthy mind to cope with any threat, and also healthy level should be promoted. At the societal level, the healthy community, the helping hand of people in community, healthy school, healthy workplace, social support, and social cohesion should be improved. It shows clearly that individualism, the country with the high individualism, less sharing, face the more problem than the country with the higher social cohesion. And lastly, at the system level, I think it's time to call back and more focus again of the sustainable development that balance the economical, social, and environmental dimension of development that should be balanced to each other, focus more on equity of people. So SDG should be, that have been dropped a bit for the last few years, should be call it back again. So finally, even when the time that we have the medical vaccination worldwide, we also should run this social vaccination together. Thank you.
Thank you very much, Dr. Suprida. And again, a very important reminder that issues such as hygiene and immune can have a systems level context that many of us tend to overlook during peacetime. And I think one important fact about the COVID-19 is to showcase how unprepared the world is to come together to address a crisis. And I see this to bear very important learning points when we start to look at some of the other crises that are not too far away, such as those crises on climate. And I think this is where I would like to invite Dr. Fernanda to share with us some of her thoughts and thinking processes around how do we prepare the world for a crisis, but this time not of COVID-19, but are some of the lessons that we learn from COVID-19 transferable when we start to think about climate resilience, climate change? Over to you, Dr. Fernanda.
It's a pleasure to be here with all of you today to speak a little bit about some of the work that we have been doing within USAID on climate and health and the link between climate and health. And specifically to present some of the initial findings of the work that we've been doing over the last 5 years and offer some insights on how this work can help inform whole of government responses in addressing both current and future health risks. We know that climate change is already having a significant impact across the world, threatening efforts to meet the growing needs of the most vulnerable. Temperatures are on the rise. The increase in extreme weather events like droughts, floods, and cyclones is also well documented. And while claiming lives, these events also foster undernutrition and catalyze outbreaks of diseases. Their continuing likelihood is really a certain impediment to development. And situation is furthermore compounded by a complex variety of underlying physical, social, economic, and political forces and trends operating across scales. Specifically in Africa, where the majority of our climate and health work has taken place, climate is, over the last couple of decades, many African countries have made significant progress in reducing child mortality, increasing life expectancy, for example, managing food security risks, and strengthening health services and systems. But climate variability and climate change really threaten to reverse those and trigger growth in disease burdens. In particular, the major strides that have been made in reducing, for example, malaria and cholera may be lost as the corresponding vectors and pathogens respond to both current and anticipated changes in rainfall and temperature. In addition to that, with climate change, Africa's leading health challenges are likely to persist and even grow, resulting in reduced outcomes. Undernutrition and stunting in particular, which you see in this slide, will continue to be a pressing concern.
Dr. Fernanda.
Yes.
So sorry about this, to interrupt you again. We're still at slide number 1.
Okay.
And
goodness.
In fact, we could see your talking points as well. It's on.
Okay. Let me just stop the sharing. And
Apologies,
let's try it again. Forgive me. I appreciate you you saying that. The technology challenges. I thought I had done it perfectly. Share this screen. What can you see on your screen? Just
Great.
the slide?
Yes, now we see just the slide, and this is on slide number 2 of 7.
Okay, perfect. Is that good for you?
Yes, it is. We do see your talking points again, but I believe we can continue.
No, let's just do it this way. Okay, can you see it now?
Yes, we can.
Please let me know if I can see the next slide. Perfect. We know that the leading health challenges are likely to persist and even grow. Undernutrition, stunting in particular, will continue to be a pressing concern, and the staple crops like maize and wheat are currently really being grown at their thermal tolerance. So potential increases in temperature will undoubtedly reduce yields and increase food insecurity. In addition, the increasing use of really less nutritious short cycle crops coupled with high levels of CO2 in the air will reduce the availability of nutrients in crops and potentially leading to an increase in nutrient deficiencies. Important to note, however, is that in many countries, preparation in the health sector is lagging, particularly for addressing emerging threats such as those from climate. And more national and international support is needed. Indeed, the countries that are expected to experience the greatest increase in climate-driven health outcomes are those whose health systems have least capacity to manage additional challenges. And whether these risks become a reality really depends on the level of preparedness of national ministries of health, healthcare systems, and professionals, together with the public awareness of these risks. Can you see the next slide?
Yes, we can.
Wonderful, thank you for that confirmation. But most importantly, we actually have an opportunity by implementing risk management measures today to reduce the magnitude of the risk that climate change poses for the health sector. So if you look on this slide, the stippled areas are the areas that are essentially the level of risk that can be reduced if risk management measures are put in place. And that requires building the capacity of the current agencies, institutions, and individuals to plan systematically for the effects of climate change. Just very basically, we know that the impacts of climate change will vary depending on the strength of the health system and meeting and adapting to the needs of the people that it serves. The broader context for human health, with the great diversity of social and environmental drivers, also plays a role. And a strong healthcare system brings together an ample workforce, reliable financing mechanisms, evidence-based policies, best scientific practices, well-maintained facilities, and requisite supplies and technologies that are able to be delivered. And because of the increasingly globalized nature of disease dynamics, an effective health system also needs capacity to control and respond to emerging public threats, such as epidemics and changing disease prevalence. The intersection of the health system and the socioeconomic and environmental context really produces a range of complex and cross-sectoral challenges. For example, cholera may be linked to excessive rainfall, but outbreak will occur primarily in areas where there's weak water and sanitation systems. So to be effective, combating cholera would also need to address both the direct health impacts of the outbreak, as well as the underlying economic and development situation that catalyzes the spread of the disease. And under a 5-year project that has recently concluded, we continue to build the evidence base on the links between health, weather, and climate through close partnerships with health ministries, universities in Africa, local governments, et cetera. And we asked a couple of sort of rudimentary questions. The first was really, what is the evidence for the relationship between climate and health? How does climate play a role in terms of being a driver of health outcomes? And how will climate change alter the disease burden in the future? And obviously, most importantly, how can we respond to these risks? The evidence from that work paints a rather increasingly detailed picture of likely declines in health outcomes across sub-Saharan Africa if risk management measures are not implemented, with regression on health indicators, an increase in the burden of undernutrition and disease, and ultimately really a growing number of people at risk for poor health, health outcomes. Nevertheless, with these challenges really come very interesting opportunities for action. In most countries, the immediate health challenges are not new. Policies and programs are in place to address them. The challenge is really to strengthen planning and policy, scale up existing programs, and expand health system capacity to address these changing factors. And a strong knowledge base of how climate variability and change can impact health will provide a foundation for decision making to reduce related risks. The approach could yield a clear context for interventions, can be incorporated into decision support tools, priorities, and planning early enough to be effective later. And our experience in this project suggests that even soft investments focused on predictive tools, for example, to inform early warning and capacity building and institutional strengthening can be just as important as hard investments like overhauling water resource infrastructure. And decisions how to manage the risks of climate variability and change often are linked with the impacts and actions that are taken by other sectors, including water, agriculture, energy, and infrastructure. They have direct impacts on health, and the cooperation across these sectors is clearly vital for reducing the risk. In addition to that, addressing climate change and the adaptation strategies that are implemented may look very similar to good health system strengthening programming. For example, to improve access to care, you develop treatment guidelines, develop timely and appropriate interventions, and train staff. The lens, however, may shift priorities in important ways, placing more emphasis on surveillance and targeted response than before. There are clear cases where risks will force even the most resilient health systems to explore new responses. And the challenges remain on how to operationalize these risks and address potential opportunities. For example, in one of the case studies that we worked on in Ethiopia, we are using Earth observation systems to provide timely information on potential malaria outbreaks at a localized scale, to understand sort of the potential spread of the disease. And finally, it's really sort of important to note that there are many promising adaptation measures that are already being implemented on the ground to respond to climate risks. And by and large, these are unknown to those that have not been directly involved in their implementation. So helping to catalyze learning about what works and doesn't in different contexts, communities, and regions is key to successfully limiting the risk of climate change on human health. Thank you very much for your time.
Thanks very much, Fernanda. I think you have highlighted that a looming crisis such as climate change can and will have the same impact as COVID-19 has on the health and well-being of populations, and potentially one that doesn't have simple or quick solutions such as a vaccine or even mask wearing or social distancing. And I think this is when I would like to pass over to Dermot Campbell-Langdrum, who is the head of WHO Department for Environment, Climate Change and Health, to really talk about some of the responses that societies and countries can put in place to prepare for a crisis that may be linked to climate change or other forms of future trends. Over to you, Dermot.
Thank you very much for the kind introduction. In fact, slightly too kind. You've given me a promotion to director of the department. I'm actually head of the unit on climate change and health within the department, but I do work in exactly in that part of WHO. So we're the part of WHO that looks to try and support countries to not only adapt to the potential health risks of climate change, as you've just heard, but also just to take the climate change challenge to health as a whole. So I'll be making a few remarks which look at that overall picture of what we think are the interactions between the two. So let me just try and share my screen, and I'm going to ask for probably a double check on whether. So we were asked in our discussion also to, of course, to make the connection to COVID. Everything is COVID at the moment. I was quite struck with the analogy that is made about effectively the world being at war against COVID, and thinking what we do, how we prepare in peacetime for the next crisis. One of the messages that I wanted to get across was that sometimes we think we're at peace, but we just have an unacknowledged war. And so even after we hopefully come out of the current COVID crisis, we will still, for example, be dealing with the climate crisis, with the huge burden that we have from environmental burdens of disease, whether it's poor water and sanitation, whether it's air pollution, killing 7 million people a year around the world. So I think it is important to do exactly what this webinar is doing, and try and think about how these kinds of challenges, both the acute ones and the longer term stresses, combine to stress systems, and how we need to build resilience into both of these challenges. So what we see as the major challenges, the two major objectives in trying to address the climate crisis from a health point of view. One of them is that we believe that we have to get behind the overall societal drive to cut carbon emissions. Hopefully you can see on the screen at the moment a graph with a line which is the basically the observed increases in emissions of carbon dioxide over the past few years, and the green part of the line is what we need to do if we're to meet the commitments that the world has taken together in Paris 5 years ago, and is about to recommit to at the next climate change conference of the parties, to keep the world on track to a 2 degrees centigrade, or ideally a 1.5 degrees centigrade or less increase in temperature. So we have to cut carbon emissions soon and very fast, very deeply, in order to meet that. And yet, unfortunately, we are way off that track at the moment. So although we may think we have enough to do within health in coping with all of the problems we have, including the threats that climate change presents to health, it is important for us to play our role in this wider objective as well. And one of the important things that we can do is to promote actions that reduce carbon emissions, but that also do so in such a way as to promote health. Clean energy systems, sustainable transport systems, more sustainable and healthy diets are the things we need to do to cut carbon emissions. But if we do them right, they're actually fantastic health interventions as well. So we think that health has a real role to play there. But of course, the other thing that perhaps the more immediate and obvious task for us is the one that's just been described in the previous presentation, that climate change throws up a whole range of challenges to health and health systems, from extreme weather events to potentially increased transmission of vector-borne disease, waterborne disease. But in some parts of the world, it is actually a survival issue. In the small and developing states, in low-lying areas, unmitigated climate change will wipe out these countries, or will wipe out the land on which many people live. So the challenge is that we can't continue to see this as a disease by disease, problem by problem thing. It has to be something where we address all of these through strengthening the health system as a whole. So we have to protect health from the full range of rising climate risks. One of the reasons I was so pleased to talk to this webinar is that you are talking about systems, and even the systems of systems, if you like, the way that the health system is also dependent on other systems, which we've also just heard. And we have looked at that from in our work on climate change and health, and looked at the work that's been done on the climate side, where they will talk about different systems, agricultural systems, natural systems, and so on, and looked at what it means to build resilience across the board into these. So we published guidance on an operational framework for building climate resilient health systems a couple of years back. And the way we envisaged this is that in the context of a health systems are always under stress, whether it's increasing demand, increasing prices, challenges, long-term challenges of climate change, and so on. But they are also hit by shocks, and COVID is a classic case of a shock. And what we try and do within the system is to drive down the exposure, to drive down the sensitivity, and to increase the capacity of the system to cope. And we also have to recognize that quite often health systems are just thinking about survival, of just thinking about keeping the functioning going and avoiding collapse, because we know they can collapse. War will collapse health systems, but if we don't, several health systems have come close to collapse under COVID. So they're often thinking about that, but there is the opportunity to really build back better, to really transform the way that we provide health systems. And a lot of that is, as we've heard, I think 2 presentations before, about looking at the determinants of health and trying to keep people healthy before they get sick. So this is why I'm so pleased to talk about a systems-based approach. One of the other messages that I wanted to get across also in relation to COVID is that we think that you don't invent a new health system for each new challenge. When we looked at the climate change challenge, it was clear that most of the things that health systems need to do in order to cope with climate change are basically can be built into the building blocks of health systems. So most countries will recognize some form of this, and those are the 6 segments shown on the inner part of this slide about leadership and governance, health workforce, information systems, provision of technology services, and financing. When we looked at it, we felt we could describe how climate change can be built into information systems. Climate change can be built into training of the health workforce and so on. So we didn't feel that there was it was either practical or even useful to try and invent new systems. It's about building those particular aspects of resilience into the existing structure. Now, often countries will want to focus on particular parts of this. In many cases, of course, they need some additional finance to address this. Health systems will often focus in on healthcare facilities because that's a concrete thing that they can't escape. They need to provide these, and that's the front line for facing up to climate change or anything else. Health workforce is the most important part of any health system, and so they will often want to build capacity within the health workforce, including to the risks of climate change. And as we've heard a little bit as well, information systems, surveillance systems are a core function of health systems, and most will want to look at whether they can use climate and weather information to improve their capability to respond to new infectious disease challenges or anything else that comes along. So we feel that conceptually it's possible to build these functions in, and we have a certain amount of experience now, a lot of projects around the world where we're starting to do this successfully. And we think that that's fine. There's a massive amount that can be done to address the climate challenge through these incremental increases in capacity building in climate resilience. But we also have to recognize as well that there are limits to this. There are certain situations and places in the world where the capacity to adapt will be exceeded. There is the possibility of collapse. And you will see this in specific places. So, for example, the image that I'm showing here is a healthcare facility in Bangladesh, where the combination of flooding and sea level rise has basically caused the health facility to fall into the water. Now, that is going to be increasingly repeated at different places around the world. So it doesn't really matter what you try and do within that healthcare facility if it's going to fall into the water. So we have to recognize that we do absolutely everything we can on adaptation, but we also have to look way upstream to take the pressure off healthcare facilities in the first place and try and support them to transform and genuinely build back better, whether it's after COVID or after all of the other stresses and strains that will continually come onto healthcare systems. So I'll just make a couple of comments on that, and I'll link back all the way back to the first slide and that challenge of getting carbon emissions down. It's clear that, as I said, healthcare systems have a role to play here. One of the roles they have to play is, in fact, that health systems are now, or healthcare as an industry is now a significant contributor to greenhouse gas emissions. It's somewhere between 4 to 5% of greenhouse gas emissions globally. So there is actually a role for healthcare systems to think how they can provide these services in a way which is also has a lower impact on the environment. And there are some really promising things going on here. There can be a reaction from healthcare systems to say, why are you asking us to do it? We should have a license to pollute if we need to because we're saving lives. But in fact, it is possible to identify many ways in which healthcare systems can provide the same or better services while also reducing emissions. And the single largest health system in the world, the National Health Service of England, has just committed to become net carbon neutral during the 2040s and has just published a detailed plan to do it. They think they can do it while continuing to improve services. So that's not only important in cutting emissions, but it's also a great example to the rest of the world. We've published a manifesto for a healthy and green recovery from COVID-19. We published that in May. It has 6 prescriptions, everything from protecting nature, sustained cleaner energy systems, and so on, to reducing the subsidies we pay to fossil fuel emissions, because we think that you can connect COVID recovery to genuinely sustainable development and climate protection. But my last couple of comments on this are that, as a couple of speakers have mentioned, it's also really important to think about the role of health systems in the wider community. And we are now starting to see a real connection between the climate and health stories in the general understanding of this issue. So probably the single most effective public mobilization, certainly of any environmental issue, has been the Fridays for Future movement of youth around the world demonstrating on climate change. And in those cases where you also have high levels of air pollution, they're also bringing the air pollution and the health message directly into that. So that's at the bottom left picture here is in India where they're doing that. And we're also seeing the health community step up and speak out on the climate crisis and make clear that the things we need to do to address climate change can be really good for health as well. We're not trading off action on health and action on climate change. We're identifying the things which are good for both. And so my absolutely final word on this is just on that role of mobilizing the voice of the health community as a voice for sustainable development and including addressing the climate challenge. And there are 2 really good arguments for why they can and should step up on this. One is that they're really numerous. There are almost more health professionals than almost any other profession around the world, embedded in pretty much every community around the world. And the final point is that they are uniquely trusted. Hopefully you can see this slide. These are actually polling data from the UK, which show the trust in different professions across the board in the UK. And on the right-hand side, you can see those which have the least trust. On the left-hand side, you can see those which have the most trust. And so there really is a role for this voice of the health community in speaking up, making clear that protecting the environment, protecting the planet, supporting sustainable development is a health goal as much as it is a climate change goal. So I'll stop there and thank you very much for your attention.
Thank you very much, Dermot. And I think you have highlighted a sombering message with your last slide that politicians at the moment are one of the least trusted people in the world. And clearly, I think you have also highlighted that societies and countries cannot continue to tackle health impact of crisis separately without involving the other sectors, many other sectors that could have been responsible for starting the crisis in the first place. And I do notice that we are running very short of time, but I thought I would just pose one question perhaps to Dr. Mary, which will highlight a little bit about this systems level approach to addressing some of the issues that we have heard so far from all 5 panelists. And this is really around the COVID-19 vaccine, because clearly one of the very near future trends that the world will be facing is the way that countries, societies, communities prepare for the deployment of the COVID-19 vaccine. And earlier on, you highlighted the importance of social protection and some of the preparations that Kenya can do better in, and as well as some of the efforts that have been put in. And I wanted to ask Dr. Mary for your thoughts really around what are the systems level preparation, including the transportation, including education, communication, trying to increase health literacy, the financing, and even on the record keeping, the registration of vaccination that may involve civil societies, NGOs to implement and deploy on the ground. So any thoughts on what are the preparations at the systems level that Kenya has put in place in preparation for the COVID-19 vaccine? Over to you, Dr. Mary.
So I will start by, these are my own views regarding the vaccine. For some of us, it still sounds like a rumor. One day it will arrive and it will be in the country to be distributed. I liked what the WHO director said, that the vaccine may not be enough, but it'll be for some people in all countries rather than for all people in some countries. So we are very optimistic about that. Our Minister of Health talked about having increasing access to the vaccine to everybody who deserves or requires a vaccine, which means the priority would be health workers in the country who are at the forefront of the fight against COVID, and persons with underlying conditions, people with NCDs, etc. This is important, but we still have a systemic problem of knowing exactly who is living with an underlying condition, how do you get them, how do you ensure they are prioritized. So we go back to the system problems, the registration problems I talked about, and the fact that we'll have a small percentage of the overall vaccine being brought into Kenya. I am worried that the priority people may not get the vaccine, that because of the leadership issues, because of personal interest, we may have other people not prioritized based on what WHO guidelines are, but because they have leverage and they can influence the system. So that is the worry we have. I'm not so sure we have very prepared in terms of how the vaccine will be rolled out. Those are plans that are ongoing now. But the issue about trust, about leadership, will still play a big role in the way the vaccine is rolled out and how it reaches the priority.
Thank you very much, Dr. Mary. And Dermot, I wanted to end off with a question to you. Quick comment from you. In your opinion, I think we are not doing very well preparing for crisis, and countries, governments are failing to really start to mobilize a whole of society response. How do you think we should really advocate for this? Because there are black swans events that will occur just like COVID-19, but equally there are what I would call the elephants in the room: climate change, antimicrobial resistance, where the data, the science clearly highlights how real the threat is, but yet remains ignored for the most parts by a number of major economies around the world. Over to you, Dermot. Quick comments, please.
Yeah, I'll be very quick. I think that the part of the challenge is making things simple and practical. One of the challenges with climate change is it's there all the time. It's a gradual issue. So it's very easy for people to make long-term promises about it and then not boil that down to actions that we are held accountable for. Although you're saying, you know, we have problems with the COVID response, from the climate change side, we look at many aspects of the COVID response and think it was fantastic because it did actually mobilize strong action. And there was some clear communication of things that people could do. So I think we're starting to get there, I think, now on the climate change side. So there is one sort of mantra, which is simple messages delivered consistently by a variety of trusted voices. That works for COVID, but it also works for, you know, for driving down carbon emissions. And I think that's the best we can do, and also to basically to make serious problems that we track and we hold people accountable for.
Thank you very much, Dermot. And we did receive a few questions from the audience, including one from Ahimsa, who really asked about whether countries where the leadership comes from the Ministry of Health, or whether countries that adopted a more technocratic approach has been more successful. And Dale, I saw that you have provided a response to Ahimsa's question. Could I ask you this question? Again, quick response in terms of whether technocratic responses are preferred in handling a crisis. Over to you, Dale.
Sure. I took the liberty of answering Ahimsa's question online, but no, I think it's about a leadership team, and this is it's crucial to recognize the diversity between all the various needs, whether it's health, whether it's economic, whether it's social, and you can't just talk about who's the leader. I guess, of course, in most countries, the prime minister or president or premier would be the leader, but still, he must have a leadership team and identify the the various needs. No one person knows everything. So I don't think it's about whether you're MOH or technocratic or science or political or industry. And you all need to be at the table and come up with well-founded decisions.
Thanks very much, Dale. And I see that we have 3 minutes left, and I thought I would use this opportunity to provide some concluding remarks based on what we have heard from all our 5 panelists and some of the questions that have emerged. The first remark that I wanted to make is really the ability or inability to respond during a crisis. It's clear that it's a function of the preparations, the investment, the forecasting even that has occurred during peacetime, be it trying to build up the trust between people and the government, or having leaders that adopt a rational, a logical, and evidence-based approach, having a team of people like what Dale just mentioned, to really try and understand the problem and to identify the solutions. And I think we hear from Dr. Suprida the second point, which is really some of the context does matter in terms of the preparations a country or the system put in place to tackle crisis. The solutions need to be contextualized locally, and what works for one country may not necessarily extend to other countries, because clearly there are variations in culture, in social behavior of the populations, variations in the wealth, the technology that's available, or even coming back to the bit about governments being technocratic in nature, or perhaps just simply being populist in nature. And the last point we heard reiterated over and over again is that the present global scorecard for COVID-19 is hugely depressing. That I think as a community, we are failing badly in our ability to come together, whether as a system, nationally, regionally, or globally, to tackle a crisis. And right now, we are in the next phase of COVID-19 on the development, the deployment of the vaccines. I do like to think that we do have a chance to redeem ourselves, to really try and, at the national level, to develop the appropriate systems that span financing, equity, education, communication, not just simply the logistics of the health logistics of delivering the vaccine. Because otherwise, it does seem that if we are unable to redeem ourselves right now, even with a COVID-19 vaccine, based on our current performance, we will fail again as the world tackles crises such as climate change, such as antimicrobial resistance, 2 major known crises that the world is facing, and yet we have yet to come up together with a proper solution at the systems level. Many countries tend to see antimicrobial resistance as a health problem. Some countries see climate change as an environment problem, but they don't recognize the implications that it has on the overall human system as a whole. So with that, it is time to end the session. And at this point, I would like to thank all our speakers, Dale, Dermot, Ananda, Dr. Mary, Dr. Suprida, for your time and contributions. I do apologize that we are unable to take more questions, but I hope this has been an opportunity for us to highlight the importance of addressing crisis at the systems level and not simply looking at it from just whether it is the health perspective, the finance perspective, or the trade perspective. So with that, thank you very much, and do have a good day to all of you who have been very kindly dedicating this 90 minutes to us. Thank you again, and goodbye.